Well, hello, all you beautiful people. You are tuning into the Peak Signing Agents podcast, where I'm helping you become the best notary and signing agent you could possibly be. I'm your host, DVO, Derek Van Otten, and I'm honored to be with you on another new episode. Thank you so much. And if you are getting value from the podcast, please, if you haven't yet, subscribe on any of the podcast platforms that you like and on YouTube. And if you're only on one, please go to the other and subscribe anyway, just so I have more subscribers, if you feel entitled to do so. I would appreciate it. And if you could also please share it with anyone that you think could get value from it. Even, some episodes are not purely about notary work. Sometimes they're about entrepreneurship and mindset. And if you think someone can get value from that, please share that with them. I would be most honored if you could. Thank you so much. Well, on this episode, I thought I'd share with you some tips on signing, notarizing in a care facility. I recently have gone to quite a few care facilities. When I say a care facility, I'm talking what you might think of as maybe a hospital, a retirement center, a rehabilitation center, and someone is there for whatever reason. Maybe they just had a procedure. Maybe they just had a baby. Maybe they're not feeling well. Maybe they are elderly and, it's just time to move on with things. They need to sell property. They need to grant someone on the title just for whatever sake. They need to sign a power of attorney. And so for whatever it is, we have to go to these care facilities. Again, when I'm talking about retirement center, rehabilitation center, hospital, something like that. I mean, I've been there where someone recently had a baby. I've been there because someone had a surgery. I have been there because they are elderly and they are starting to lose, their right mindset, their right thinking. And they just can't have pure ownership anymore of a property or of their bank accounts or things like that. It's time they have to have someone help them, a family member. And I've been there where someone is basically on their deathbed. It's coming to the end for them. And that just, is a reminder of how important our job is. We are there for important documentation. And we need to take our job seriously and our role very serious. Because we are the front line of making sure that they are who they say they are and they understand what they are signing. Because if it's someone's end of times or they're losing their mindset, we have to make sure of these things. So I want to give some tips to you if you have an appointment coming up at a care facility, whether you are doing a loan closing, like they're selling a property, or general notary work, they're signing over a power of attorney, whatever it is, I want to make sure that we do things properly and give you the right tips. So whether I'm getting a phone call from a family member, or a signing service or a title company saying, hey, I need you to go to this care facility. When I call, you're not always calling the person to confirm. Because again, maybe they don't have the right mindset, or maybe they just had a baby. They don't have their phone on them all the time. They're too busy taking care of the new baby. But one thing I do, if I'm calling, let's just say, they say, hey, you're meeting with somebody, but you'll be contacting their daughter, their nephew, their sister, whatever it is. When I call to confirm, one of the most important things that I do, because they are probably not at their home, so now obviously sometimes they live in a care facility, but sometimes they don't live in like a rehabilitation or hospital. So they don't live there. So I just say, hey, please make sure that the person I'm meeting with has valid ID. Now, again, follow your state's laws. My state will accept an expired ID, and it's up to my discretion how long maybe it's been expired, and how comfortable I feel. Some states accept it if it's been 6 months or a year or even up to 3 years. They'll accept an expired ID. Some states do not accept an expired ID. So again, follow your state's laws, but I do tell them, hey, make sure I prefer valid ID. So I say, please make sure they have valid ID. Now they might tell you, oh, well, they don't drive anymore, so they don't have a driver's license. I'm like, that's fine. Do they have a state ID? Well, they haven't driven for so long. They don't have a passport. They don't travel. They don't have a passport. They don't have a driver's license. They don't have a valid ID. They said their driver's license expired 6 years ago. This has literally happened to me. And I say, 6 years ago? They don't even have like a state ID? They say no. And I tell them, I'm sorry, I can't help you. You should always have valid ID. And on a side note, everyone watching and listening to this, especially from doing this job, everyone should always have valid ID. Even if they don't drive, get a state ID. Everyone should always have a valid ID. If you need to go to the bank to do things, they want valid ID. So I always tell people, make sure they always have valid ID. And from doing this, I will always make sure, even if my parents get to that point in their lives when they're a little older, and maybe they're not driving, and maybe they're in a care facility, I will always make sure they have valid ID on them. You just never know. Anyway, that's a side note. So when I call to confirm, I make sure they have valid ID with them. And the person I'm calling or talking to, like, oh, great point. I don't know where their purse is. I think their purse is with them. I go, will you please verify that before I come over? Please make sure they have that in hand before I come over. The other thing that I do is, let's just say they're saying, okay, yep, you're meeting with my mom. I'll be there as well. Because I always do ask, will you be there as well? Because I want to make sure that the person in the care facility feels comfortable with me. I'm a stranger. I'm having paperwork and I'm explaining important documentation that they will be signing. It's important that if the person is not always with it mentally, that I want someone there that they'll be comfortable with, like a family member or a close friend. So I do verify, will you be there as well? And they say yes or no. And the most important thing I say is, do they understand what they're signing? I want to make sure they know before I come over that they understand what that they're signing. If I do talk to the person, I can tell maybe they're a little elderly on the phone, or maybe they're hard of hearing. I'll just say, so just to make sure you understand, we are signing a power of attorney. We are signing the sale of your home, or I don't say your home. I don't know if they live there. Sale of a property is what I say. I try to get that verification before I go. So that is something that I do when I'm getting prepared and I'm calling to confirm the appointment. I'm making sure I'm going to the right place, and I make sure I get the room number. Or are we meeting in the lobby, or are we meeting at a room number? If it's not in the instructions and I know I'm meeting at a care facility, I do like to know, because there's some places that have in the lobby little rooms. They have little side rooms, and I've done plenty in little rooms in the lobby, and I've done plenty in the rooms of the person in the care facility. So I do ask, are we meeting in the lobby or am I meeting you in the room? And if so, what is the room number? Is there a table there? I always bring a clipboard when I'm going. I always carry a clipboard in my notary bag anyway. But if you don't carry a clipboard, I advise that you carry a clipboard into care facilities, because you don't know the person's position. Are they bedridden? Are they not able to get up? Are they they're in bed? They just had a surgery, or, like I said, I've been there on people's deathbed. They have days or weeks left, and they can't get up. So it's easy for them to kind of prop them up, in the bed. They raise the bed up, or they put pillows behind the person to kind of prop them up a little bit. And they're signing in the bed, so I have a clipboard. If you're in a hospital, you might have the food tray there that they can use. That's a little tip for you. They might have the food tray there. But if not, having a clipboard is very handy. Guess where I bought my clipboard? When I first started, I bought it at the dollar store. So you can buy them at the dollar store. You can buy clipboards there. They're the basic cork boards, but they were $1, so I'm happy with it. Anyway, I carry a clipboard. And I make sure to have my pens on me. I'll have, pens that, if they're not feeling well, they can keep the pen. Or if they're, like I said, a little elderly, maybe I'll have them use the gel pen versus the ballpoint. It just writes smoother and just makes it smoother for them to write. So I carry a couple different pen options with me in those care facilities. Again, when I go there, I do ask, All right, just to confirm, you understand what we're signing, even though I confirmed on the phone beforehand. I might have only confirmed with their relative. I am confirming with a person. Just to confirm, we are signing this. This is the sale of this property in Salt Lake City, Utah. Just to confirm, is that right? Okay. I always want to get that confirmation. I get their ID. We do the signing. I'll double check it because I don't want to come back to the care facility. I want to double check it, triple check it while I'm there, make sure we got everything taken care of. If witnesses are required, a care facility is a great place because there's usually someone there that can be a witness. So that's always nice with a care facility. Now, another point with IDs. Some states, if they don't have valid ID, they do allow credible witnesses. Again, follow your state's guidelines. But a care facility might have great resources for credible witnesses because they've been treating that person, they've been talking with that person. They enter them into the care facility. Sometimes the managers or nurses can be used as credible witnesses. Again, follow your state's guidelines when it comes to credible witnesses and state IDs. I don't know every state's laws. I thoroughly know my state's laws. Like I said, I just renewed my commission and got 100%. Just a little small brag there. All right, so those are some of my tips for you in the care facilities. I hope that helps. I hope things go smoothly. Always just make sure you do things a little bit more delicately. I make sure I talk slow, I talk clear, I talk loud. Because again, sometimes the people in the care facility are on the elderly side. And so I make sure I do talk loud, I talk slow, I talk clear. I'm pointing to the paperwork. I'm making them comfortable. I'm making sure they understand what they're signing. I'm making sure it is really them. I had a phone call a couple months ago that they said, hi, my name is, I can't remember their name, but they work for a law firm. And they said, hey, just want to let you know there is a court case going on with somebody that you notarize with. Do you remember this person? And I said, I can't say that I do. They say, okay. They said, we can't imagine. Maybe you meet with a lot of people. I said, I meet with a lot of people daily. They said the person signed and got notarized this document. The family feels like maybe they didn't do it properly or they weren't in their right mind or something like that. I can't remember exactly what they said, but they did say, but just know you were the notary. And so you might be called into the court case. And I said, that's fine because I feel comfortable in what I do. I make sure everyone understands what they're signing. I verify it is them on their ID. And I keep a notary journal. Now, my state does not require a notary journal. However, I do keep a notary journal to save my own butt. And in fact, I use the notary journal, an electronic notary journal called Notarize. If you don't use them, again, I have an affiliate link that you can click on in the YouTube and podcast description. You can click on that. What I like about Notarize is I can take a picture of their ID and it stores it there. So I always have a copy of their ID and it scans the barcode on the back of the ID. And that helps validate that it is their true ID. You can fake IDs, but to make a barcode on the back that will scan the exact information that's going to be near impossible for scammers. So I feel very comfortable that everything matches when I scan the front to take a picture and I scan the barcode on the back and it populates all their information, their name, their date of birth, their ID number, everything is in that. If you've ever been to a restaurant or a bar or a dance club and they scan the back of your ID, that's what they're doing. They're making sure everything matches up. All your information is on the back of ID and you're recorded as being in that location. It will also detect the location I'm in for the signing. It will detect where I'm at the location. How cool is that? And I can do factors, verification factors, like I checked their ID, it had their face, it had their description, or when I say face, it had their picture, their description, all in there. And I can also put, this is the documents that we notarize. I did the deed of trust, that was an acknowledgement. I did the occupancy, that was a jurat. I can go through and populate all those things in, all those entries in of every page that we notarized. How cool is that? So if you're not using something like that, I recommend it. Click on my affiliate link. Anyway, hope that helps you if you have to go to a care facility. Hope these tips will help you if you've gone, you're like, oh, I wish I had this. Another tip that I have, I do have my notary bag with me today. I don't always when I record. I'm sorry, opening it up. I have this little device that helps as well. I got this on Amazon. I got this from a tip from my friend Notary. Her name is Irene out in Arizona. She has this. If you see it, you have to go to YouTube to see it, but I'll describe it if you're listening. It is a rectangle with another rectangle cut out in the middle. It's the size of your driver's license. Like I said, it's just a rectangle. The size of your driver's license, but inside is another rectangle cut out. It's the size of a signature. This helps people know where to sign. I found a red one on Amazon. They mostly sell black ones, but I was able to find a red one because people have a hard time seeing sometimes. They have bad vision, and if they're in a care facility or if they're elderly, it's hard for them to see where to sign. So I got a red one because I put this over the signature line, and it helps them know where to sign if they have poor vision. So this is a cool little thing that I also make sure I take with me if I'm going into a care facility. I always have it in my notary bag anyway, in case I'm with someone that has poor vision. It just helps them see where the signature line is, and they stay in the box. So again, if you're watching on YouTube, you can see it exactly. But if you are listening, it's a rectangle the size of a driver's license it's a card with a rectangle cut out in the middle, the size of a signature area, so that they can sign in there. Anyway, hope this helps you. Keep being awesome out there. Keep doing our job. Our job is so important. Like I said at the very beginning, we notarize very important documents, and it's important that we do our job thoroughly. We make sure what we're doing, we make sure the person understands what they're signing and that they are who they are. That's a key part of our job. Keep being awesome, as I know you are. Keep striving to be the best notary and peak signing agent in your area. And I'll talk to you on the next episode. Bye now.